So once again, good morning or good afternoon. We will start the TEF Health Call 1 information webinar. Today for this webinar, we have three main speakers. It will be myself, Cristiana Costa, representing TEF Health Portuguese node. It will be Petra Ritter, that will be representing TEF Health coordination team, and Ricardo Pires, that is the EIT Health InnoStars team member that will be presenting also the application platform embedded in this presentation for today. So moving forward, what is the order of the day, and what you can expect. We will have a TEF Health testing and experimentation facilities presentation, an overview on what you can expect from this partnership. We will detail the call 1 step by step, and later on we will go in deep on what is the application form, how it works, and how it should be used. During all the sessions, you have access to the Q&A. That is a small button below your screen. You can use this Q&A to put your questions that will be answered during this webinar in the written format by all our team. Some of the questions can also be answered at the end of this webinar. So please don't be shy and include your questions in this box. Following for the presentation of TEF Health, I give the word to Petra.
Yeah, thank you very much, Christiana, and also warm welcome from my side. My name is Petra Ritter, and I am the coordinator of the testing and experimentation facility for health, AI, and robotics. My affiliation is the Charité in Berlin, in Germany. And the objectives of the testing experimentation facilities in Europe are to bring excellence AI from the lab to the market and to facilitate trustworthy AI uptake in Europe. It's important to note that there is not just a healthcare TEF, but there are 4 sectorial TEFs funded in the European Union in the fields of healthcare, agri-food, manufacturing, and smart cities and communities. Next slide, please. Next slide, please. Thank you very much. The goals are to bring artificial intelligence health applications to the market. And what is lacking presently are testing facilities and protocols and standards for validating the trustworthiness of these technologies. And the testing and experimentation facility for health, AI, and robotics, short TEF Health, develops facilities and services and standards for testing trustworthiness of AI applications on the one hand, and provides the services to SMEs and startups on the other hand. The TEF Health is funded for 5 years by the European Commission and by the member states with a total of 60 million euros. And a significant part of this funding is translated into cost reductions of the services that are offered to the SMEs and startups. So SMEs, for instance, get access to the excellence facilities. They can test their AI solutions. They receive cost reductions for the services during the project duration of 5 years. And they also receive support in market access. The service providers, on the other hand, get access to the SMEs, to their customers. They get also access to the newest AI solutions, and they receive funding to develop their services and orchestrate synergies and complementary services across the member states. Next slide, please. So the overarching aims of TEF Health are first to validate AI solutions in real health environments, and second, to facilitate market access for AI solutions in health. The consortium presently comprises 52 partners from 9 countries: Germany, France, Sweden, Slovakia, Portugal, Belgium, Finland, Czech Republic, and Italy. And it comprises labs at hospitals and universities, for example, medical imaging labs or digital medical devices labs, but it also comprises partners such as notified bodies and authorities. For example, in Germany, we have the TEF Association on board, or the National Metrology Authority, PTB. And the same is the case, for example, in France. There we have the LNE on board that does certification and also develops standards. Additionally, we have very central partners in Europe that provide digital infrastructures across the member states and already established networks such as EIT Health, that has provided a community platform with thousands of SMEs and innovators, or eBrains that provides a digital research platform that, for example, provides access to trustworthy virtual research environments. The funding for TEF Health is 60 million euros. Half comes from the European Commission, the other half from the member states and the partners. And as I mentioned already, a large part of these funding sources is translated into cost reductions for the services that are being offered to SMEs. The project runs 5 years. It started 1 year ago in January 2023 and ends in 2027. And the project is already ongoing. As I mentioned, it started in January last year, so it runs now for 1 year. Next slide, please. Apologies. Here you see the map of all the members of the consortium, the 9 countries, 2 of which are associated. This means that they are presently not receiving funding from the European Commission. So this is Czechia and Finland, and 7 countries that get the full funding from the European Commission and the member states. Finland also gets national funds, so they are partially funded. And you see here the funding sources, which differ. Largely they are governmental. In Berlin, for example, we are getting the co-funding from the Berlin Senate, from the state of Berlin. In Belgium, the Wallonian government provides the co-funding. In France, the Ministry for Economy. And in the other partners, also the ministries, basically, or their associated organizations provide the co-funding. The overall coordination is done at the Charité and the Berlin Institute of Health in Berlin, Germany. Next slide, please. Here you see the logos of the 52 partners. And several of you might know. And as I mentioned, this is very versatile. We have about 50% of partners in the public sector and 50% of partners in the private sector. Next slide, please. So importantly, we have actually an official event taking place at the beginning of March, on 4th of March in Berlin, that is called All TEFs Open for Business. It's a joint big event between the 4 sectorial TEFs, TEF Health, AI Matters, this is a manufacturing TEF, then TEF Agriculture, and Sitcom, the Smart Cities TEF. We all together officially open up for services on 4th of March in Berlin. Registration presently is open. We can provide the registration link to you. Maybe someone can put it in the chat if that is possible. So you're very much welcome to join this event. It will be very interesting. We have the politicians there, the European Commission, but also SMEs who present their products and also the challenges that they are exposed to given the many new regulations in Europe. But we also have legal advisors there. We have certifiers there who share their experience. Also, we have an exhibition of all the services of the 4 TEFs that might be of interest. Next slide, please. This diagram shows you the different service categories. And as you can see, really, the range of services is really broad. We provide consulting services in the fields of ethics, legal, and society. We provide access to physical testing facilities, for example, robotics facilities, operating rooms, or intensive care units in hospitals. We provide virtual testing center services, access to health data in compliance with law, of course, but also trusted virtual research environments and health data clouds. We provide education and dissemination, standards and quality control, certification. Yeah, we are very much interested in developing new certification algorithms together with the SMEs that provide their technologies that might need HL certification, because these are software products that are frequently updated. We also provide clinics, AI and robotics, expertise consulting, and support in business development and integration. And also services that are already major can be discovered on our TEF Health website. Yeah, the URL is shown here. Very soon we have a new entry point to the services that enables easy browsing and keyword search. Presently, you can download Excel sheets that provide an overview of all the services presently major and available. And we are very happy that we have now the very first call for applications open. And with this, I hand over to Cristiana Costa from IPN in Portugal to present this very first call of our TEF Health.
Thank you very much, Peter, for the very relevant introduction. And let's move on for what is the instrument, what is meaning this TEF call 1, and how you can apply and benefit from it. So the TEF Health Call 1 opened officially in the beginning of this month and is available in tefhealth.eu/call/call1 with all the details. This call is actually engaged to the service provision of 4 of our partners, from the Portuguese node, that are IPN, Health Cluster Portugal, and the hospitals from Coimbra and from São João in Oporto. So what is implied within this TEF Health? What is the timeline and what is the contact info? So within this TEF Health Call 1, what you will gain is the access to service providers, the Portuguese service providers, and the catalog that they have prepared in these last few months to you for the benefit of your solutions and services in the health field that apply AI or robotics. The targets of those services are SMEs, and the deadline of this call is actually not a fixed deadline as a date, but the call will close when we benefit 100 products or pilots within this instrument, or we achieve the 30th of September 2025. The results of your applications will be communicated within 45 working days, so as soon as you submit your applications. And for questions related with the application process, the contact information is tefhealth.eithealth.eu. For all other questions related with TEF Health is info@tefhealth.eu. What you can gain if you are approved with through this call. So the objective of TEF is to support in validating AI solutions in real health environment and to facilitate the market access for AI solutions. So what we are doing is to build up an infrastructure of support to startups that will provide us support to increase the maturity of their solutions from TRL 4 until TRL 9. So what we have, as Petra explained it very well, is physical in vitro testing services in place. We have certification support services, and we have also business skills support services. The objective of this call is to support your solution or service to jump in level of maturity, being the goal at the end of the pilot that your solution is in the minimum of TRL 5. Meaning that the minimum for you to jump and apply to this call, it will be TRL 4, that is the validation of technology in lab. What are the services that we have now in the service catalog from the Portuguese partners? So we have physical and virtual testing centers that are providing services of access to clinical facilities, testing and validation of the solutions, analysis and validation of clinical requirements and the assessment of it. And we have also space for tailor-made services. Basically, we are looking for what are the needs, what are your needs. We will analyze those needs and we will basically assess an internal availability to support your solution. In terms of certification support services, what we have is the support to technical product documentation, technical regulatory map gap analysis, regulatory support for obtaining CE mark, and specialized regulatory consultancy. One related to the business skills services, we have business model development, business development support services, and specialized training in business skills. So in a really broad format, what you have now in this slide is big blocks of services that we have in place. The detail of the services that we can provide are actually in tefhealth.eu/call, where we have the full list of services within these three major blocks. You can analyze the details and also to structure your application in the right format. Where to find information? Once again, tefhealth.eu/call is your entry point for to be a benefit of TEF Health Consortium and services. You have a web page with all the information on what is TEF, what is the call that is open, and if you click on go to TEF Health Call 1, you will have a dedicated page for this call. It's important for you to revise these 5 documents that are in this web page. So we have a press release, but the 4 major documents are the TEF Health Call 1, where you have all the details on the objective of the call, the eligibility criteria, the evaluation process and criteria, and what are the step-by-step from the application starts until you're receiving the final results. You have also a very relevant document that is the service catalog of PT Note. This is the updated information on all the service that you might be gaining access if you are applied, if you apply and are approved to call 1. It's the detailed information on the 3 major blocks that I have presented in the previous slide. You have application form details, so all the structure of the application, all the questions that you will need to fulfill and detail. And you have also a Smart Simple guidance. Smart Simple is the application form, is the application platform that you will be using for your application, and that will be detailed at the end of this presentation. So what is the step-by-step? So first, phase 1, you should register in Smart Simple platform, the application platform. You should, of course, submit your application to TEF Health Call 1. You will be screening in terms of eligibility. You will go through an evaluation stage. And finally, if all this goes well and you are approved, you will gain the access to TEF Health Service Catalog and the service providers. So what this means in terms of stage by stage. So phase 1, when go to tefhealth.eu/call1, you have a button where it's pretty clear where you should apply. So you click in apply now, and this will give you access to the Smart Simple platform. If you have already registered in this platform, you will go log in and directly to the application platform. If not, you should register in the Smart Simple platform, and after this, you will gain access to the application form. So after this registration, you will go directly to the programs and opportunities within EIT Health platform, application form, the Smart Simple, and you will have one of the calls named TEF Health Call 1, and this is where you should apply for TEF. After the application, you will be screened in terms of eligibility and what this means and what are the terms. So as informed in the previous slides, this call is targeting SMEs. And the SMEs have to comply with this criteria, are legally incorporated and established in one of the EU member states. are nominated SME according to EU definition. And these two are actually documents that you should submit to prove those two criteria. The other three have not received over 200K in state aid support during the previous 3 fiscal years. Having AI or robotic solutions with a minimum of technology readiness level or TRL of 4, and were not supported or are under support by another Portuguese test bed. So the first two are legal documents that you should submit in the application phase to prove that you are an SME and you are incorporated in one of the eligible countries. The third is, or if you are a European startup, non-Portuguese, and you are applying to state aid under GBER, you should self-declare that you did not receive the 200K in the last 3 years. The last two eligibility topics are also self-declared. Okay. If you are checked by the eligibility, the next stage would be to assess what is the quality and the fit of your application with what we provide as TEF Health Call 1. And the criteria are the ones that are here described and the ones that are described in the text call available in our website. So criteria are divided by 3 major topics: solution description, and the application presents a novel solution that is innovative and promotes clear advance beyond the current state of the art. The applicant presents a clear and feasible timeline for the solution. The second is the solution addresses a significant unmet medical need. And lastly, the soundness and consistency of AI or robotic systems and core technology used. Then we will analyze what is the fit of your need to what we can offer in TEF service catalog. So the applicant may needs may be supported by the service offering provided in the current TEF Health service catalog. Service offering in TEF Health service catalog will actively facilitate and support the expansion of the company to new EU markets. And finally, if the solution can increase the technology readiness level after the implementation of TEF Health services within a 6 months period. So this second is really an important assessment, because basically it will detail if the need that you have, what you are missing to bring your solution to the market is answered by us, and if we can support you or not. Finally, the last big criteria is the funding. Mainly, I would like to say that is more treasury capacity on your company. So the applicant provides a budget availability that aligns with the prices of the current TEF Health service catalog and demonstrate having a solid financial track record with the capacity to cover the estimated expenses of acquiring TEF Health services. So if you have, of course, the need, but also if you have the budget available to acquire TEF Health services that are at a discount price, but even though they have a price to be paid. If you are assessed, if you are evaluated and your application is above the threshold that is established 5.0 in 7, you will gain access to the service catalog and to the next stage. It is important to say that all these criteria are evaluated between 1 and 7, being 7 the maximum score, and the exception to it is the criteria number 6, that is if your application actually can increase the maturity of the solution itself by using TEF within this period of time. This is a critical criteria that you should really take a look and analyze within the service catalog that we have publicized. What means to have access to TEF Health Service Catalog? So if you are approved to the application, you will be contacted by TEF Health that will be analyzing your needs and will be suggesting you a meeting with what will be the service provider within the 4 that we have right now in our service catalog. Hospital of Oporto or Coimbra, in this case São João or Coimbra, Instituto Pedro Nunes or Health Cluster Portugal. This matchmaking will be done. It will be assessed what are your needs. You will be booked with a meeting with your service provider that will be analyzing and detailing with you what is the service that you are needing, what are the details of it, and what is the extension of it. And will present to you a proposal, not only a technical proposal, but a financial proposal that should be discussed between the 2 parts, the service provider and the SME. If you find out an agreement, you will be required to sign an adhesion agreement to TEF Health, TEF Health testbed. And the implementation of the services will go through after this signature of this agreement. What we intend is, of course, to run with you the pilot, the pilot, or to increase the maturity of your solution, and at the end, depending on the level of TRL that you have increased at least 1 level in your maturity of the solution or service that you have in place. So I will stop my presentation and give the word to Ricardo, that he will present to you what is the platform and how it works. We cannot hear you, Ricardo.
Can you hear me now? Yes. Yes, can you hear me now?
Yes.
Okay, sorry for that. So I'm Ricardo Pires from TEF Health Stars, like Cristiano already presented. I'm just going through a little bit here the look and feel of the application form. So the application is actually, like Cristiano already mentioned, accessible through here, the Apply Now button. Okay, if you go to Apply Now, you'll get this initial entry point for the application format, that is the Smart Simple. So you have been already participating in some of the programs of EIT Health in the past, you might be familiar with it. So once you actually log in, and let me go back to explain you a little bit more in details here. Like Cristiano already mentioned, Smart Simple Guidance walks you through the registration either individually or as an organization on the Smart Simple. So the documentation is also here. You can access to it and follow the steps so that you can get the registration done, so that then you can go into the platform. Once you're in the platform, you'll have a screen looking similar like this. This is test environment, so not exactly the same like you'll see as a user itself. At home, and the home section button here, you can get to something similar like this. You go, like Cristiano mentioned, to programs and opportunities. And then you have a list of things, like I was saying, if you already were participating in previous programs of EIT Health, you have multiples of them. Otherwise, you'll probably have access to only TEF Health. If you go to Apply Now, then you'll get into a different step. I'm not going to do that because I'm already on the draft mode. Once you start an application, you can go here to Application and Activities, and you have your ongoing draft application in preparation. So we can open that. Okay. And then you'll get into this. So previously, to actually get into this application format, you'll get one actually extra screen that I'm going to share here with you that looks like this, okay, that is a new application where will be need to be asked to actually tick this initial eligibility part that Christiane already mentioned. Some of them are here. Once you tick, you'll get access to the actual application format like you see here. At any point, you can actually download the application form summary. It will give you the information, more detail of what you have already filled in different fields. From the initial screen where you check the eligibility, let me go first to out of these 8 sections that we have here that you can jump in between them. Shows that these are different sections of your application. Let me go to the last one because it's very much connected with the eligibility part. You'll need to upload some documents, and this documentation, this uploading is done here at this uploads and consent last section on your application format. So some of the things have been confirmed by you on the previous screen prior to actually open your application form, and they will be already ticked. Some of them you have to tick additionally, and then you have fields to actually drag and drop your files that are asked for you to do so. Some of them are only for the Portuguese context and Portuguese incorporated companies, but it's very much straightforward to understand out of the description and also from the call document description, the main document of the call. So let's go back to the intro section. On the intro section, you have the program that you're applying to. In this case, it's only TEF Health. CLC part is very much connected with EIT relationship, and that has to do with the way you registered yourself and the company. So it's not relevant for the application itself now. It's just internal. Submitter also have some personal information and organization and company information. Again, it's going back to your individual organizational profile that you can update on your individual profile button on your startup and team profile button here. On the next section, company and team, now the application to TEF Health starts in particular. So the category that you can choose, either AI robotics or AI or robotics, that you can choose out of this category part. And then on the field, from digital therapeutics to all the others that are here listed, you can go and select some of them. So I'll just have this one. Medical domain, there are a few of them already here, but you can additionally actually add others, okay? And you can move forward for one of the most important sections, that is the solution description. So product name, acronym, elevator pitch. So be careful that the elevator pitch can be publicly available. So be careful with confidential information that you input here into the elevator pitch field. Then next steps on the development of your solution. So very much to do with different aspects of your solution, maturity of your solution. Here, for instance, which data requirements you actually have. So the features, the kind of data that you are actually using or needs of, if you have already data sources previously. Then on this section here, you have a duplication. So you have an AI or an AI and robotics field. Once you click one or the other, you'll have a set of different questions below that are just related to either the AI solution, if your AI solution is more based on AI, or if you have merged robotics and AI, you have a different section of questions. A little bit more customized to this category. Then we go through the unmet needs. So how big is your unmet need, and who owns the problem that you're trying to solve with your solution, and so on. In terms of TRL level, like Christiane already mentioned, so you have to define your TRL level of your solution. So the entry is TRL 4, but this is very much well described in the call document in terms of why the cutoff is here. And the ultimately expected improvement of TRL. And then here in terms of development strategy and business model, is your solution already having or has been requesting regulatory approval? Does it has a C marking, an FDA marking, MM marking? So you need to select out of these ones. In terms of health, TEF Health needs of the services in particular that we have in the catalog that you can select, and we'll go back to service in particular in the next section. But here we want to understand a little bit more how we are going to use this service and the impact that you expect them to have on your TRL evolution and the maturity of your solution, the improvement of this maturity itself. in terms of the expected outcomes, also aligning a little bit more with what you expect. And then in terms of the impact on your solution to actually access the market, what is TEF Health expected to come from your point of view? Then the expectations in terms of timing, expected starting date, expecting end date, project duration is automatically calculated over here. And then in terms of how do you envision the incorporation of these TEF services in this overall maturity journey, if you want, of your solution. You can enumerate a little bit here, but let me go now to the service section. It is kind of interesting for you. So as Christiane showed you in the beginning, you have a catalog of services available for this call in particular. This catalog is going to be increasing in terms of offering for the next calls, future calls, international, transnational calls. Here you will be asked, according to the call documentation, you'll see, you'll be asked to rank your preference of services, and you'll be asked to select 3 services that you'd like to prioritize. So you'll just go and to add new services, okay? Then you select the ranking. So I have already 2 there. Let me put the rank as my 3rd priority here. I select wherever a core service here, and then the name of the service that is listed is all according to the catalog that is available on the website also. Save record, and then you have to actually confirm additionally your service, and then everything is set and done for you to have your 3 priority list of services prioritized according to your wish in terms of priorities, and all the descriptions, like I told you, is on the documentations. Okay, going to the next section, the funding and financial. Also, like it was explained previously, there are some numbers on the catalog of services in terms of price per hour per resource. It will help you to estimate some sort of budget estimated for this validation service. So you'll give us here a price window of the services, and then below we are asking you to actually explain a little bit better your financial capacity, like it was also explained by Christiane, so that we understand if you have some co-funding capacity to cope along with the TEF services and the discounts available. So finally, TEF Health involvement is very much on metrics, so very straightforward in terms of perception of what you have been, how you heard about this thing, and so on. And the last section I have already described is where you can upload the documents and so forth. If you have any other doubts, you have already the emails that Christiane shared with you. Additionally, on the application form documents, you do have a notes here that you can introduce questions that will get automatically to the managers of this call. And so if you have any questions in particular for your application in particular, you can just drop the add here a new note, and we'll get this from our side, and we'll get back to you as quickly as possible. I think from my side, that's it. Thank you.
Thank you, Ricardo. I will just pick up here a few questions that we had in our chat. That's I'm not sure if are available for all, so I will pick up here one question about the event of 4th of March. So the event will be streamed, and Petra, if you would like to detail here a little bit on what will happen, now people will get access. I believe that the link for registration was already shared with all in the chat box.
Exactly, yeah. Thank you very much for sharing the link. I think this was a registration link to Eventbrite, and the registration is open. Everyone interested is welcome to join.
Thank you, Petra. Would like also to inform that this webinar is being recorded, and it will also be shared in TEF Health webpage for future revision, and the information on the contacts is also available in this presentation. So moving for more information regarding where you can find news, updates, events, or other opportunities. So we have, of course, our major door is our webpage, tefhealth.eu, but we also have a community that we are creating, that is TEF Health AI community. You are expected to join to engage with us there, and all the information about the call or new services that are being added to the current offer offer will also be disseminated here. Ricardo, I don't know if you want to give here a word about this community.
Yeah, so please just join the community. There's a lot of interactions that are going to happen now that the calls are open and more activities are out there. So we'll be happy to have all your feedbacks and some news events that you might just be willing to share, and some topics of discussions that you can actually bring to our discussion forum that is going to be now a little bit more boost from the next months. Thank you.
Thank you, Ricardo. And to close, I would like to thank you and say that all the questions that you mapped out here during this webinar will be translated and not translated. It will be integrated in the FAQs document that will be available not only in the TEF Health webpage, but also in this community that we just shared with you for future assessment. Once again, tefhealth@tiethealth.eu if you have questions regarding the application process, and info@tefhealth.eu if you have questions about TEF Health. Please reach us and we will support you in the manner that you need. Thank you so much and enjoy the rest of the day.